I am a prison nurse. This stethoscope symbolizes the sacrifices I have made, as well as my family, to become a nurse. It is not just a piece of rubber and metal, but a part of my life that I am grateful to experience and learn from. If your child breaks a bone or your loved one needs a surgery to save his or her life, a nurse will most likely be by your side. I have devoted my life to caring for those who cannot care for themselves and educate those that need guidance. My name is Talia. Let me tell you a little bit about myself. I was born and raised in Fulton, Missouri. Some would say that if you blink too long, you drive all the way through it. My parents were once happily married, but are now divorced. My father was a Marine stationed on the eastern coast of the United States and in Grafenwehr, Germany. My mother worked in a shoe factory. She then served as a military wife, running an in-home daycare. I graduated from New Bloomfield High School in 2010 with my nurse assistant certification. In 2013, I married the man of my dreams who served in the United States Navy. I became a licensed practical nurse in 2015 and a mother to a baby boy in 2016. I would now like to share the nursing aspect of my life. As a nurse, I provide hands-on care in hospitals, nursing homes, home health settings, and many more. But I provide care for offenders at the prison in Fulton, Missouri. I take vital signs, I administer medications, dress wounds, and respond to life-threatening emergencies. Most of my caregiving experience was to the elderly as a certified nurse's assistant. I aided with all activities of daily living, caring for my residents in their most vulnerable moments. I have worked with nurses, therapists of all kinds, and doctors. The care nurses could provide intrigued me and drove me to become a nurse. Lastly, educating patients is a huge responsibility as a nurse, and every nurse holds the title of a nurse educator. What does this spot look like to you? Is the most frequent question I've been asked in my career thus far. I cannot diagnose as a nurse, but I do educate people on normal and abnormal assessment findings, disease processes, and treatment options. Barriers to teaching must be creatively overcome at times. Lack of education and language barriers are most commonly presented in the prison setting. To conclude, nurses aren't just the typical white uniform and hat. We love, we care, and we educate every chance we get. We stand by your side and fight for your rights as a patient. Nursing is a beautifully exhausting profession, but it is one that I am proud to be part of. Thank you.